We simply cannot compromise on this subject. This has to change. Everyone is getting ripped off on health insurance, and they're getting ripped off even more if they have no health insurance. Want to know why so many people never pay their hospital bills? Watch this video and learn. I have a friend who related a story to me about a dental procedure he had a few years back. He had no dental insurance, so he asked 3 dentists for a cash price, and each one quoted him about $1,300 for the procedure. I believe it was for a crown. He was going to have to pay the full amount of $1,300. Then he decided to call and ask Delta Dental Insurance how much they paid the dentist for that procedure. The insurance told him that they would pay $800 for that procedure. So he went and asked the 3 dental offices if they would accept the $800 cash for the procedure, since that's how much they would get if he had insurance. All 3 said no. So he went to the last dentist himself and asked him personally. He was told, yeah, no problem. When my friend told the dentist his front desk had said no to the offer, the dentist told the front desk to accept it. He thereby saved $500 just by asking questions. So let's take a look and see what the federal government requires hospitals to tell us. Then let's look at what the hospital actually tells us. There's a specific law that came into effect January 1st, 2024. Hospitals must have a link in the footer of their website, including the home page, labeled exactly Price Transparency. Now, here's the one from our local hospital, and if you notice by the arrow, it says Price Transparency. And then here's one from a hospital in Charleston. They have the same thing in the footing of their page, Price Transparency. So far, so good. They both complied with the federal law. No problem. Now, as of 2026, hospitals have 2 separate federal price transparency requirements. The link must take the user directly to the publicly available page that hosts the link on the hospital's user-friendly database. And then you should also be able to access a machine-readable file, which contains all the contract data for all the health insurance companies they accept, and the contract prices they charge and accept for each of the companies for each procedure. Now, this is a huge machine-readable file. The hospital must make one comprehensive machine-readable file covering all hospital items and services. It must include standard charge information, such as gross charges, discounted cash prices, that's if the hospital has established one, payer-specific negotiated charges. The cost on each procedure are supposed to include everything that the hospital and its employees provide. 2026 rule also added other requirements concerning allowed amounts, but we're not going to get into those rates right now. Now, here's the giant file that you can download. The machine-readable file is supposed to be public accessible without barriers. No payment, registration, account, password, or submission of personal information. It's all supposed to be digitally searchable. So here's the machine-readable file at our local hospital. There are 121 lines of different contracts for just one procedure, an X-ray for the fibula. Here are the 3 pages of contracts for the different insurances. If you notice, column O on the top has the cash price, which reads $322.40 on all the contracts. Now, there are over 60,600 lines of contracts for all the procedures and supplies at that hospital. Now I'm going to show you pages 2 and 3 real quick, which shows there are 121 lines of contracts for this one procedure. Now this shows you the contract amounts the hospital has just with Blue Cross Blue Shield for the different types of contracts. $261.68, $59.98, $113.09, $94.74, $296.75, and $113.09. Notice what the Blue Choice Exchange is, $113.09. You'll see that in a minute again. Now compare that with the hospital in Charleston. It only has 11 lines of contracts for that procedure. But notice Charleston doesn't have a cash price. Why? They simply don't have one. Now here is the Blue Cross Blue Shield contracts in Charleston. $37.48, $101.01, $66.64, $94.08, $39.45 twice, $49.98. Is this crazy? Also notice that the Blue Choice Exchange contract price is $39.45. Now compare that with the local hospital I showed you a minute ago of $113.09. Why is this such a huge difference? Then there's the consumer-friendly information. The law says the hospital must also provide pricing for at least 300 shoppable services that a patient can schedule in advance. If the hospital provides fewer than 300 shoppable services, it must list as many as it provides. That information can be presented in a consumer-friendly format and include the applicable standard charges, including the discounted pricing, payer-specific negotiated charges, minimum and maximum negotiated charges, plain language description, applicable ancillary services, customary accompanying services. Or the hospital can satisfy this consumer-friendly requirement with an appropriate online price estimator tool that allows a consumer to obtain an estimate. So here's that transparency page that allows you to do either option of a self-generated estimate, or you can request an estimate. I chose the self-generated estimate. It takes you to a page and asks you if you want to continue without insurance, a cash price, or you can put in your insurance company, and it'll tell you how much the insurance pays. I chose the cash price estimate. You have to go through a couple of other steps, but it takes you to a page where you tell it the service or procedure you want. Since we are talking about one thing, the X-ray, I put that in. It came back with this. What's funny, it comes up with a different estimate than the machine estimate of $322.40. What's also different, this one includes a physician fee of $28. Is this for reading the X-ray? Did the machine estimate not include reading the X-ray? I'd have to ask and find out. If it is a hospital-employed doctor that reads the X-ray, it's supposed to be included in the pricing. If it's a contracted doctor, it doesn't have to be. When I first looked at the price estimator tool, they asked the question of whether I wanted to go to the hospital for the X-ray or an imaging center several miles away. It doesn't mention anything about pricing or anything else. Since those prices we just looked at are from the hospital, I decided to also check out the imaging center. So I went to the imaging center, and this is what I got. Here's the cost. Total fees, $240. Cash discount, $84. Total owed, $156. I had no idea an imaging center was cheaper, especially that much. And of course, they don't tell you that anywhere. $341 versus $156. I said, holy crap, that's a $185 difference between the cash cost at the image center and the hospital. How many people would ever know that unless they went looking? The imaging center is about 54% cheaper than the hospital's $341 self-pay cash estimate. I had no idea the imaging center was cheaper. But that's the point. The federal government says transparency is supposed to allow consumers to shop and compare. We just demonstrated exactly where the consumer needs to be given all the information and encouraged to use it. The hospital's price estimator can show you that an imaging center is cheaper than the hospital cash price, but the imaging center isn't necessarily subject to the same hospital price transparency database yet. So I went looking for the imaging center's price transparency database. It doesn't exist. And that's one of the problems with the system we have. The federal hospital transparency law is only about hospitals. But healthcare isn't provided only by hospitals. That's why my proposal for a new law doesn't say hospital. It says every medical provider. And there's an even bigger lesson here. I didn't discover the cheaper price because someone told me. I discovered it because I went looking. And that's precisely what this entire proposal is built around, placing the consumer in charge of their own healthcare and pricing. But the consumer can't be in charge if the information isn't easily or readily available or even know that it exists. Wait a minute, what else don't I know? If you have an insurance policy, say with a $10,000 deductible, chances are the insurance will pay for some procedures, but not for others before your insurance fully covers everything. So that means you'll have to pay 100% for various services at your insurance's rate. If the cash price service is lower than what your health insurance contracts for, why wouldn't you consider the cash amount? Let's take the x-ray of the tibula fibula for a minute. The hospital says its standard fee is $496. But I couldn't find one contract the hospital charges that amount. So what is the $496? What's it for? How'd they come up with that amount? One of my questions is who would pay that amount? The only person I can think of is a cash customer that doesn't ask for a discount because they don't know that there is a discount. Out of the contracts, there are only 11 that are more than the cash discount. 11. There are 110 that are less. So here's my big question. By hospitals charging cash-paying customers more than the insurance companies, who are probably those individuals mostly unable to pay for expensive health care in the first place, are the cash-paying customers actually subsidizing the health insurance companies? By charging the cash customers more than the insurance companies, does that allow the hospital to charge the insurance companies less? I can't say they are or they aren't, but it sure as hell looks like it to me. And if it is, that has to stop. So if they ever pass the law that says cash customers get the lowest contracted pricing, I'm sure the lowest price would rise. But even if the lowest price for the tibula fibula x-ray was 75 or 100 or maybe 150, that's far better than the 322.40. And the absolute best part would be that it applies to not only hospitals, but all medical providers. And here's the one part that bothers me most. When consumers stop caring about price, we've removed one of the most powerful forces in any marketplace. And that's one of the reasons we have healthcare today the way it is. Let's get it changed. If you'd like to view the proposed changes to the law, please watch our first video. I'll leave the link in the description. So what do you think? Let me know in the comments. I'm Tim, a wise old fart, and thanks for watching. Please like and subscribe for more great videos. Have a great day. Thank you.